Hi everyone, this is my first channel and I need your support. I need your subscription to decide whether I should make more videos under these topics. Today we see tricks for cardiac catheterization data solving, and I'll use some pictures here. In this video series I'm using marshmallows, both blue and the pink color marshmallows, and we'll see how it make your life easy. Okay. Cardiac catheterization data, some are telling it's very difficult to solve, but it is easy, and I'll make it more easy for you with these pink marshmallows and the blue marshmallows. First, when we get a question, we have to draw a small diagram, and you can write a draw diagram as you like. I like prefer to draw it like this: the right side in the blue color and the pink color left side. In the left side heart, but at exam we are not putting colors, but when we practice we don't want to put any colors for that. At the beginning, if you like, you can put colors, uh, but I do understand it's very difficult to remember the right atrium 0 to 8 and right ventricle 0 to 18 in the diastole and the systole 15 to 13 and pulmonary artery it's 15 to 13 and 3 to 12 in the diastole and pulmonary capillary wedge pressure 1 to 10 and left atrium again 1 to 10 and left ventricle systole 120 diastole 5 to 10 and aorta 130 to 80, and it's difficult to remember, right? And there's a trick to remember all those. You have to just remember number 10, 10 and 20. Let's see what is that. Okay. What you have to remember is number 10 again, number 20 then. Okay. See how it make your life easy. Right atrium. Usually they are not giving diastolic pressure or systolic pressure separately. They are just giving right atrial pressure. Usually it's within the range of 10. Then in the right ventricle, considering the diastole, it's in the 10. And pulmonary artery also, it is diastole within the 10. And pulmonary capillary wedge pressure also in the 10. And in the range of 10. And the left atrium also in the range of 10. And left ventricle diastole also in the range of 10. Sometimes 10 to 20. So altogether, all the diastole in the right atrium, right ventricle, pulmonary artery, and left atrium and the left ventricle, except the aorta, all are within the range of 10. You just remember number 10, and when you go to the questions, you draw a diagram and put those numbers and check whether there are any high diastolic pressure. So there's a problem there, okay? And one thing more I like to add, sometimes at the exam, left atrial pressure they are not given. At the exam, instead of that, we have to take the pulmonary capillary wedge pressure. So for the data question solving, if they not provide us left atrial pressure, we have to take the pulmonary capillary wedge pressure as equal to the left atrial pressure, and we need to use our calculation taking the pulmonary capillary wedge pressure instead of the left atrial pressure. Okay, we'll see such questions uh, in coming videos, and I again request to subscribe, because this is the first channel I'm doing, and I have to decide whether I should go forward with producing more and more videos whether it's useful to you. Okay, and when you subscribe, that is support to me also. Thank you. Okay, so remember number 10. So there are no calculation at the first steps. Just remember number 10 for the right atrium, right ventricular diastole, pulmonary artery diastole, pulmonary capillary wedge pressure, left atrium, left ventricular diastole. Okay, now I think all of you remember this, right? So before going into the discuss about the marshmallows, now you remember number 10. Then next step also I told number 10. Then next step also number 10. What is the second step for the number 10? That is um, that is when we are checking for the aortic stenosis and the pulmonary stenosis. If I tell it another way, if there's a gap between the outflow tract from the left ventricular outflow tract to the aorta, if there's a gap up, that should be a drop. That means the left ventricular side has a high pressure and the aorta has relatively low pressure. That means there's some narrowing in the aortic outflow. There's some obstruction at the aortic outflow, left ventricular outflow, left ventricular outflow. That is favoring aortic stenosis, HOCM. Okay, and if that gap was there in the right side, then that is favoring pulmonary stenosis. Okay, and the pulmonary stenosis can occur in the tetralogy of the palate, so that can favor tetralogy of the palate also, because of the pulmonary stenosis can be there. So why I told all those here? Because there also the number 10 is the value we have to remember. Okay, let's see. See, the next step, the second step I told, that's written now. Remember the 10 again with a small month. Just we have to minus the left ventricular pressure from the aortic pressure, or the right ventricular pressure from the pulmonary artery pressure. In that case, in the left ventricular pressure minus aortic pressure, if it is more than 10, that is favoring aortic stenosis, so HOCM. And right ventricular pressure minus pulmonary artery pressure, that will favor pulmonary stenosis. It also can seen in the total load of the palate. So another more thing I added here, that is coarctation of the aorta. There's a gap of 10 between the ascending aorta and the descending aorta. So which side should be having a higher value to tell like that? So that is, ascending aorta has a higher pressure, and then there's a narrowing. Then after the narrowing, that pressure is less, so pressure gap of 10 is there in the coarctation aorta. When ascending to the descending aorta, the pressure gap of 10 is there. You understand, right? Okay. So still we are not allowed to go for the marshmallows. Why? Our first step is looking for the 10. Next step is looking again the 10. Now next step is searching for the 20. Still not going for the marshmallows. Okay. Now what are the things? Look at the 20. Okay, I'll show that. Here are the things. If the left ventricular paleo or left ventricular infarction is there, left ventricular end diastolic pressure is usually more than 20. Other thing is in the mitral regurgitation, pulmonary capillary wedge pressure have a V wave with pressure of more than 20. Usually at the exam papers, when we are preparing for the exam, when we are pacing the exam, I have never got any mitral regurgitation questions. I don't know whether they are put in that. Then other thing is the pulmonary hypertension, the pressure will be more than 20. Okay, now we are going back to our theme, that is cardiac catheterization with the marshmallows. So still not allowed to go for the marshmallows. Now we did the 10, again 10, next 20. Now next thing is looking at the saturation. Okay, saturation wise, numbers you have to remember is 75 and the 96. Okay, in the right side we expect low value, so it should be below 75. If it is more than 75, that's a problem. And in the left side we expect values more than 96. If less than 96, that's a problem. So with the saturation change, the gap, we can decide which level this shunt is occurring. If in the right side we expect a saturation of 75 or below. If the saturation is higher, more than 75 in the right atrium, then there should be some ASD or some shunting at that level. And if that saturation higher occur in the right ventricle level, then that shunting is occurring at the ventricular level. So VSD or some lesion should be there. And from where to where the shunting is occurring. So if the right side saturation is rising, that means from the left side to the right side blood is going. So oxygenated blood is going to the right side. That's why they are having high saturation developing in the right side now. So in the otherwise also we can identify if the saturation is dropping in the left side, that means the oxygenated blood is coming to the left side from the right, so reversal of the shunt has occurred. So if the saturation drop occurring in the left atrium, then possibilities are the ASD with the reversal of the shunt. Reversal of the shunt we are calling it Eisenmenger with the pulmonary hypertension development. With the reversal of shunt occurring, we are calling it Eisenmenger with the ASD. If that saturation drop occur in the left ventricle, then the ventricular level shunting is occurring. Okay, I think you got it right. Now you are allowed to go and discuss about the steps of evaluating marshmallows. Okay, so pink marshmallows, we have 6 steps to evaluate, and in the blue marshmallows we have 8 steps. 8 steps I divide into 4 main groups. So altogether pink marshmallows 6 things, and blue marshmallows we have 4 main things to decide. Okay, see, in the left side we need to look whether there is any mitral stenosis features, mitral regurgitation features, left ventricular failure features, diastolic failure, or aortic stenosis features, aortic regurgitation features, or coarctation of aorta. For the mitral stenosis, there's a narrowing in the mitral valve area, so higher pressure will be in the left atrium. So left atrium to the left ventricle, blood is flowing through the mitral valve, so left atrial pressure will be high. I told previously, left atrial pressure usually equal to the pulmonary capillary wedge pressure, PCWP, so PCWP pressure will be also elevated. And that is the one thing we can see, high PCWP. And the second thing is left atrial pressure minus left ventricular end-diastolic pressure. That is the gradient between the left atrium to the left ventricle. That will be high. And that is sometimes when they are not giving the left atrial pressure, we have to take the PCWP instead. Okay, that is for the mitral stenosis. And next thing is the mitral regurgitation. For the mitral regurgitation, usually we need the PCWP V wave, and that value is more than 20. That I told when we are discussing that 10, 10, 20 steps. Yes. And the next thing also, we already discussed that also during the 20 step, 10, 10, 20. Here the 20, that thing. In the left ventricular diastolic failure, usually left ventricular diastolic pressure will be more than 20. Okay. See. This is easy, and you watch this video once, or you can download and you can see this video again and again, and you can understand, then you can do all the questions correctly. We are going to the second pink marshmallow. This is aortic stenosis. Aortic stenosis I previously described you, that is from the left ventricular outflow tract there's a gap of value of 10 of drop. That from the left ventricle to the aorta there's a pressure drop of more than 10. Okay, you know now already. And aortic regurgitation, that is very easy. Aortic regurgitation during the examination also we know they have a high pulse pressure. That is, what is pulse pressure? Systolic blood pressure minus diastolic blood pressure. There's a huge gap. And that sometimes at the exam they are giving the aortic pressure. But sometimes some questions they have providing the femoral pressure. So even in that also, if there's a huge pulse pressure, that is favoring the aortic regurgitation. Other thing is we told that all the diastolic blood pressures are within the range of 10 except the aortic diastolic blood pressure. Aortic diastolic blood pressure is high, but all other areas usually diastolic blood pressure is within the range of 10. But sometimes in the left ventricle I told it can be 10 to 20. Okay, but if the aortic regurgitation, as the blood is flowing backward, with time aortic diastolic blood pressure will be equalized to the left ventricular end diastolic blood pressure. That we can see in some questions. Okay, you try to remember that, it's easy to remember. Okay, and the last thing in the pink marshmallow is the coarctation of the aorta. Coarctation of aorta, you know, that is what, that is 10 10, second 10 group. Okay, that is the gap of 10 of pressure between the ascending aorta and the descending aorta. Okay, if we go back what we discussed up to now, so we discuss number 10, then number 10 again, number 20, then the saturation value 75 and the 96, and then we move to the pink marshmallows. There were 6 steps. Okay, the 6 steps are mitral stenosis, left atrial pressure will be high, so PCWP high, and the gap between the PCWP minus left ventricular end-diastolic pressure, that will be high. Mitral regurgitation, I told it's very rare to get in as questions, and that is PCWP high with the V wave with the value of more than 20, and left ventricular failure, diastolic failure, in left ventricular end-diastolic pressure will be more than 20. In the aortic stenosis, there's a gap between the left ventricle and the aorta. There's a drop of blood pressure of 20, that is systolic blood pressure. In the aortic regurgitation, we get the pulse pressure, higher pulse pressure, systolic blood pressure minus diastolic blood pressure. There's a gap. Sometimes they are giving at the aortic level, sometimes they are just providing it in the femoral level. And with time, aortic diastolic blood pressure get equalized to left ventricular end diastolic blood pressure. And the last thing is the coarctation of the aorta. You know that is one of the 10 group, that gap of 10 between the ascending aorta and the descending aorta. I think all clear up to now. Okay, and now we are moving to the blue color. We have I put 4 marshmallows and I divide into 2, then we can discuss 8 things. Okay, so I'll try my best to make it simple, the right side also, if you can understand. Okay, we'll focus them on one by one. First thing is the isolated right side heart pressure elevation. That means the pulmonary artery pressure not elevated here. Isolated right side pressure is elevated. We can divide them into 2 situations. One is right ventricular infarction. You know, during our day-to-day life, when the patient get a myocardial infarction, in the right ventricular infarction, they are getting low blood pressure. Low blood pressure means systemic blood pressure they are having. We are checking blood pressure at day-to-day life. We are not checking the right side blood pressure. No, we are checking patient systolic blood pressure that is low, and we need to give some fluid resuscitation for the right ventricular infarction. That is this situation. That is this one. So right ventricular infarction, although they are having high pressure in the right side, isolated high right side pressure, but they are having systemic systolic blood pressure as a very low value. Okay, so that is the difference here. That's the point to remember. And another one with the isolated right side elevated blood pressure, that is with the pulmonary stenosis. With the pulmonary stenosis, there is no pulmonary hypertension usually, and not in the tetralogy of the palate also there is a pulmonary stenosis, because in the tetralogy of the palate there are four components. Tetralogy of the palate is overriding aortal, right ventricular hypertrophy, and pulmonary stenosis and VSD. So in that case, with the pulmonary stenosis, we previously also told, right from the right ventricle to the pulmonary artery there is a gap of pressure. Right ventricle have a high pressure and pulmonary artery has a low pressure. So in the pulmonary stenosis or the tetralogy of the palate, there is no pulmonary hypertension. Isolated right side blood pressure elevation is there. Right side heart blood pressure elevation is there. So how to differentiate these two is mainly by the systemic hypertension that is occurring in the right ventricular infarction, that is not occurring with the pulmonary stenosis or the tetralogy of the palate. So that's the thing. So first group, now I think you got it right. Okay, try to remember the first group is the isolated right side heart pressure elevation. We can divide into two, whether it's a right ventricular infarction, other possibility is whether it's the pulmonary stenosis or the tetralogy of the palate. So how we differentiate the two, that is with the right ventricular infarction, systemic systolic blood pressure will be low. With the pulmonary stenosis or the tetralogy of the palate, systemic blood pressure will be normal, and there's no pulmonary hypertension. We get a gap of 10 between the right ventricle to the pulmonary artery. Try to remember, these are important for the question solving. Okay, and now we are moving to the second one. You just focus on the diastolic blood pressures in the right side and the left side also. So that in a one group of patient, I'm talking about the second one group of patient, they get left atrial pressure, right atrial pressure equalized. Okay, in both group of patient, atrial pressure will be equalized, but in the first group, the blue color one, they get equalization of the left ventricle and the right ventricle diastolic blood pressure. That occur with the constrictive pericarditis and the cardiac tamponade. But in the other group, they get the right atrium and the left atrium diastolic blood pressure equalization, but they have different left ventricular diastolic blood pressure and the right ventricular diastolic blood pressure. At least there is a gap of 7 between the left ventricular diastolic blood pressure minus right ventricular diastolic blood pressure that occur in the restrictive cardiomyopathy, because of that septum also having restricted movement, interventricular septum. So that is the second group. If I tell it again, in the second group we are focusing for the diastolic blood pressure, and we divide into two. That mainly when we are focusing for the diastolic blood pressure, we are checking for the constrictive pericarditis, cardiac tamponade, and the restrictive cardiomyopathy. And the constrictive pericarditis and the cardiac tamponade, both condition has equal right atrial and left atrial pressure, right ventricle and the left ventricular pressure. But in the restrictive cardiomyopathy, although they are having equal left atrium and the right atrium pressure, there is a gap of at least 7 between the left ventricular diastolic pressure minus right ventricular diastolic pressure. Okay, that is the second group. Now we are moving to the third group. I think you are with me. Okay. In the third group, you focus for the systolic blood pressure. Okay. In this case, we are looking at some situations where systolic blood pressure become equalized between the right and the left. One case is right ventricular systolic blood pressure equalized into the left ventricular systolic blood pressure that occur with the VSD. Another place of systolic blood pressure equalization we are looking is right ventricular systolic blood pressure becoming equalized into the aortic systolic blood pressure. That think again, So how comes right ventricular blood pressure become equalized to the aortic systolic blood pressure? So the aorta should be arising from the right ventricle, right? When it occur, that occur with the tetralogy of the palate because of the overriding aorta. Another case is the transposition of the great arteries because now the aorta will be rising from the right ventricle. Now we are moving to the third one, last one, fourth one. In this case, we are focusing for the pulmonary artery. Okay, in the pulmonary artery, when we get a higher value, before telling it's purely due to pulmonary hypertension, we exclude patent ductus arteriosus. That's important for questions. I had seen several questions for that. Okay, and in that case, we need to look at the diastolic blood pressure and the saturation. With the PDA with time, diastolic blood pressure in the pulmonary artery get equalized to the diastolic blood pressure of the aorta because there's a flow between them. Okay, otherwise we know we know that diastolic blood pressure usually within the range of 10 except in the aorta, but with time in the PDA they get equalization of the diastolic blood pressure between the aorta and the pulmonary artery. But when we compare it with the pure pulmonary hypertension, there is no diastolic blood pressure equalization. Actually, diastolic blood pressure in the pulmonary artery is less than the aorta. Then we are checking other point here to differentiate between pure pulmonary hypertension from the PDA is looking for the saturation. Saturation, when there is a left to right shunting, that is in the early stages of the PDA, there is a saturation picking up in the right side. But with the Eisenmenger occurring, that means with the time when the right heart pressure is more than the left heart and the right to left shunt is occurring, there is a saturation dropping occur in the left side. So saturation change occur with the PDA. But when we check for the pure pulmonary hypertension, there is no saturation change in the pure pulmonary hypertension. Although for the pulmonary hypertension per se, there is a pulmonary artery pressure will be high more than 20. That will be there. So again we are moving back to summarize that right. So moving to summarize the blue color side. Blue color first one we check the right side pressures are elevated, mainly right ventricular in the one which has the low systemic systolic blood pressure. Other one is the pulmonary stenosis of the tetralogy of the palate, where there is no pulmonary hypertension usually and systemic blood pressure will be normal, and there's a gap of 10 between the right ventricle and the pulmonary artery. Second group is we are looking for the diastolic blood pressure. In the constrictive pericarditis and the cardiac tamponade, there is equalization of all the four things, left atrium to the right atrium and the left ventricle to the right ventricle in the diastole. But with restrictive cardiomyopathy, left atrium will be equalized to the right atrium, but there is a gap of left ventricular diastolic blood pressure minus right ventricular diastolic blood pressure, at least there is a gap of 7. Then we focus for the systolic blood pressure. This is equalizing in the VSD, that is right ventricular systolic blood pressure will equalize to the left ventricular systolic blood pressure. With the VSD there is a flow of blood. Then other place of equalization is occurring between the right ventricle with the aorta, when the aorta is arising from the right ventricle, right, like transposition of the great arteries and the overriding aorta when it occurs in the tetralogy of the palate. And the last thing is looking for the pulmonary artery. And pulmonary artery, when there's a high pulmonary artery pressure, we can take it for the pulmonary hypertension. Because confine it to the pulmonary hypertension, we need to exclude PDA. Because in the PDA, for that we look at the diastolic blood pressure and also saturation gap. I think you remember it, okay? It's raining here. So below it say draw a small diagram, remember value 10, again the gap of 10, again remember value 20, and left side pink marshmallows 6 things and right side is it's 8 things, but we group it into 4. Now you have done it and congrats, well done. Now we're finishing, we are at the end of the be confident. Now you can solve all the questions alone with 6 steps at the pink marshmallows and 8 steps at the blue marshmallows. Subscribe to my channel to support me, and I'm trying to be back with questions and answering videos soon. Wait for cardiac catheterization marshmallow series. Okay, hi, thank you.